Okay, moving forward with this WHO guidelines on health adaptation, let's look at this box on protecting health from climate change, vulnerability and adaptation assessment. Vulnerability assessments are typically based on a few indicators, could be women's education, per capita income, socioeconomic class, and so on. And having them quantified allows you to identify specific pathways through which vulnerability can be reduced, for example. In response to the request in 2008 from the World Health Assembly for WHO to support countries in strengthening actions to protect health from climate change, WHO and the Pan American Health Organization PAHO built on past guidance and technical tools to outline a flexible process for vulnerability and adaptation assessment. The guidance is designed for countries to assess which populations are most vulnerable to different kinds of health effects, to identify weaknesses in the systems that should protect them, and to specify interventions to respond. Further, the resulting assessments can improve evidence and understanding of the linkages between climate and health, serve as a baseline analysis against which changes in health risk and protective measures can be monitored, provide the opportunity for building capacity, and strengthen the case for investment in health protection. The steps in conducting assessment should be responsive to the country's context and needs, which will determine what steps to conduct and the appropriate order in which they should be conducted. Basic components of an assessment are: first one, frame and scope the assessment. So define the geographical region and health outcomes of interest, identify the questions to be addressed and the steps to be included, identify the policy context for the assessment, establish a project team and management plan, establish stakeholder process, and develop a communication plan, which is always critical. Secondly, vulnerability assessment. Describe the human health risks of current climate variability and recent climate change, and the public health policies and programs to address the risks. This includes describing the current risks of climate-sensitive health outcomes, including the most vulnerable populations and regions, describing the current capacity of health and other sectors to address the risks of climate-sensitive health outcomes, and thirdly, impact assessment. Project future health risks and impacts under climate change. This includes describing how the risks of climate-sensitive health outcomes, including the most vulnerable populations and regions, may change over coming decades, irrespective of climate change. So you need to have a plan whether climate change happens or not, and then make it very region specific and local. Estimating the possible additional burden of adverse health outcomes due to climate change. So that's going to add on top of what would happen even without climate change. Adaptation assessment. Identify and prioritize policies and programs to address current and projected health risks. This includes identifying additional public health and healthcare policies and programs to prevent likely future health burdens, prioritizing public health and public care policies and programs to reduce likely future health burdens, identifying human and financial resources needed for implementation and potential changes to be addressed, estimating the costs of action and inaction. So you need to know what are the cost benefit of action versus inaction, identifying possible policies and programs to reduce the potential health risks of adaptation, and greenhouse gas mitigation policies and programs implemented in other sectors. Finally, 5, establish an iterative process for monitoring and managing the health risks of climate change, which we'll see in this figure here. Vulnerability and adaptation assessment process. So you have frame and scope of assessment itself, and managing and monitoring risks. So here you have what we already said: defining the geographical region and health outcomes of interest, identifying the questions to be addressed and steps to be used, identifying the policy context for the assessment, establishing a project team and a management plan, establishing a stakeholder process, developing a communication plan. So we talked about vulnerability, future impacts, and adaptation. So here, identifying and prioritizing additional interventions, identifying resources and barriers to implementation. So the input here from health harms and benefits in other sectors, interacting with communicate, plan and implement, and monitor and evaluate, which again goes into adaptation. So they should be all responsive and flexible to the extent that you can actually have systems built to respond continuously or at a reasonable time step. Looking at the example of essential baselines for monitoring the effects of climate change on malnutrition, you have health. So factors include health effect excuse me, health effect of malnutrition in children, vitamin and mineral deficiencies, nutritional status, with various measures here such as percentage of children underweight, so weight of for age below 2 standard deviation of WHO child growth standards and so on. And you have existing resources such as WHO Nutrition Landscape Information System, and for these also you have various measures and resources. Nutritional status, proportional of undernourished as a percentage of the total population. We looked at this in the food crisis response and food system resilience. It's the same thing, and we relied on the IFPRI report for that. So here again we will rely on IFPRI Global Hunger Index as an existing resource. You have other things like food-borne illnesses, infant and young child feeding, health interventions and adaptation responses with measures like prevalence of foodborne diseases. So these color codes here, boom, 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 boom. I should have, no, they just sectors. So health, foodborne illnesses, infant and young child feeding, health interventions and adaptation responses. In the environment you have sector, factor, measure and existing resource again. So you have climate, so things like freshwater withdrawals, agricultural irrigated land, early warning systems on reduced rainfall and emerging food safety, and you have these various resources here. You also have water as an environmental sector, agriculture again important for food availability and access, of course relates to nutrition as well. So here you have proportion of population accessing improved drinking water sources and sanitation, or under agriculture you have average amount of food available for human consumption based on the FAO national food balance sheets and so on. Okay, so in the socioeconomics you have food affordability, poverty, livelihoods and health expenditure. So various measures here and resources. Finally, cross-cutting issues to be considered when worrying about building climate resilient health or health adaptation plans. Environmental determinants of health, for example, different geographical settings, urban versus rural environments and housings have to be considered. Gender, equity and other social determinants of health are important. Resilience of health systems, for example, availability and accessibility of health services, climate resilient and health promoting strategies in healthcare facilities, new climate resilient hospitals built environments not prone to flooding. Flooding typically results in lots of waterborne diseases in the aftermath, especially in tropical countries, because warm temperatures favor tremendous explosion of pathogens, and floods and rainfall tend to spread the pathogens and make people sick, especially diarrheal diseases. So even a country like India is highly vulnerable to diarrheal diseases. Okay, even a country like India, in the sense compared to its neighbors, is economically much better off, and yet the effective measures to prevent or reduce outcomes of diarrheal diseases is not as effective as it should be or could be. In addition to monitoring, ex post evaluations of implementation of the HNAP and related programs are highly recommended. These evaluations should provide information on relevance, effectiveness, efficiency and sustainability, as well as impact. Okay, so let's leave this report on climate resilient health from WHO here, and we'll come back and look at some IPCC AR6 comments on or evaluation of climate change impacts, adaptation needed for health outcomes. Okay, so let me leave this one here.